tonight's discussion is going to be based on a topic which is fairly common and poorly diagnosed in women. We're going to talk about blighted ovum. Blighted ovum. Most times, most people won't even know this particular condition happened, but you have to pay very close attention to this topic because it's a topic that will be very useful to you. So we're talking about blighted ovum, and the first thing we want to discuss is what actually blighted ovum is. So you see, pregnancy is something that is very exciting. It changes your life. You're so excited when you see that, positive test in your urine. You're so over the moon. But like I normally tell our members, you're not fully confirmed a pregnant lady until you've done your ultrasound and we've seen that the embryo is there, that the sac is there. So what happens in blighted ovum is a situation where normally the sperm will meet the egg, fertilize the egg, no problem. The fertilized egg will implant in the womb, no problem. But for some reasons, for some explicable and inexplicable reasons, of which most times what can cause this might be chromosomal issues or cell division or poor quality egg or poor quality sperm. So normally, after the fertilized egg is implanted in the womb, about the 5th to the 6th week, the whole developing baby is supposed to form what we call an embryo. That's the normal standard. Remember, in some women, after fertilization, they can have bleeding. That bleeding might coincide with the implantation time. So the time the fertilized egg is trying to settle in the womb, because the womb is friable. By friable, I mean the womb is sensitive. It's supplied with a lot of blood vessels. So in course of trying to settle in the womb, they can experience spotting. That spotting is called implantation bleeding. So most women can bleed during pregnancy, especially in the first trimester. But almost all the women that bleed still go ahead to have normal pregnancy. But there are a couple of women that bleeding might be a sign that something is going wrong. So you have to report all bleedings. So in blighted ovum, for some reasons, about that time, you're supposed to have the embryo forming. The embryo will not form. And deceptively, when we check your beta HCG, which is the pregnancy hormone you check in the urine, and the blood, it will still be high. Because once you've confirmed that pregnancy is ongoing, the placenta will keep producing beta HCG. But in this situation, the production of beta HCG is deceptive because there are so many other conditions that can lead to production of beta HCG. So the only criteria you need to confirm clinical pregnancy is to go for ultrasound and demonstrate that the sac and the embryo is there. So if for any reason you don't have the sac and the embryo demonstrated when you go for your ultrasound, you're likely gonna have this situation I'm talking about, or you might have a condition we call chemical pregnancy. So just getting a positive test is good. And luckily, most people don't even bother going for the ultrasound, they just live their normal life. But clinically, for you to confirm pregnancy has occurred, we have to see the egg, we have to see that sac, the gestational sac, because that's where the baby, the fetus, and everything we're gonna develop. So that's what blighted ovum is. So it's a pregnancy without the embryo. That's why it's called an embryonic pregnancy. You don't have an embryo inside the place it's supposed to occur. And it's very, very common. It's very common. Matter of fact, it's the leading cause of early pregnancy loss or miscarriage. And the reason is this. Most people that have this don't even know. Let me just explain. So most women that have blighted ovum don't even know, because guess what? It's very silent. So you can miss your period and you will just think maybe my period is a little bit delayed. Then suddenly your period comes. It gets delayed for a few days or about a week. Then you have heavy bleeding. Then you probably have cramps, just like you normally have in your period, without knowing that you were actually pregnant, but the pregnancy wasn't viable. So you've lost the pregnancy early without knowing. So there are so many women that go through this. They just normally think they have their normal menstrual period, which was delayed, without knowing they've actually miscarried. So if you're not actively looking forward to having a baby and you're not actively checking your beta HCG, so many women would have lost their baby without even knowing they had a baby. So it's the one of the most common causes of early miscarriage. But let me just say this. In as much as you have blighted ovum, the chances of you having another blighted ovum is kind of limited. You can have it, but it's not going to stop you from having a normal delivery, a normal baby. So it's something that is bound to happen, and it didn't happen because of what you did or what you did not do. There is absolutely nothing, absolutely nothing you can do to stop blighted ovum. It's an accident that must happen, because nature and God, it's very, very creative. I know it's very painful losing a baby, but let me tell you this. Your baby that will stay will stay. The baby that won't stay, it's not going to stay. No matter how you beat yourself up, it's not going to stay. That's the reality in life. So you have to be careful. You have to know where to draw the line. You have to know to make sure you don't overreact. You know, when you put so many emotions into something, it's very hurtful, it's very painful, but most times we don't even know why things happen. So anything that is related to the chromosomes, because chromosomes are the things that carry your genes. So if in course of development something happened that was terribly wrong, the body will reject that. Most times the body wants to be in the way God created it. So the body will not want to carry a baby that is not developing okay. That's what actually happens in most miscarriages. There are, however, some types of miscarriages that can happen because of some specific causes. So if you have some infections in your body and it's not properly treated, it can lead to miscarriage. If you have what we call incompetent cervix, if your cervix is not competent, that means your cervix is not able to retain the baby, you can have miscarriage. There are so many other things that can lead to miscarriages. But one key thing you have to understand, anytime you have any sign that something is not sitting right, you have to seek help. Don't sit back and try to figure things out. No assumptions. Like I mentioned, so many women will have bleeding in pregnancy. So many. 85% of women can have bleeding, but they will still go ahead and have their normal baby. So the fact you're having bleeding doesn't mean you're going to lose the baby. The fact you're having bleeding doesn't mean the baby is going to stay. It can go anyway. But the most important thing is to report to your caregiver. Very important. So I've already mentioned the likely symptoms and likely way blighted ovum can present. So it can present with nothing. It can present with your getting a positive pregnancy test, missing your period, having normal cramps, having normal heavy bleeding, without knowing you've actually miscarried that baby because of this issue. So it can be deceptive. And let me just remind us, remember, any baby that dies on its own or any pregnancy that ends on its own without being induced or forced before 20 weeks, is termed miscarriage. After 20 weeks is called stillbirth, which I discussed yesterday. So that's the classical cutoff point. So anytime you have loss of your baby before 20 weeks, it's classified as a miscarriage. But if it goes beyond that, it's called a stillbirth. So whichever way, the baby is not going to be viable. What do I mean by baby is not going to be viable? The baby is not going to be alive. But we have some specific terms we use to classify all these terminologies. Very important. So normally when the egg is fertilized, like I mentioned, the normal pattern is the egg gets fertilized, the eggs move from the tube, gets to the womb, implants, 5 to 6 weeks, it settles, and guess what? The sac develops. The embryo is already there, but for some reasons, which I've already explained, the sac might still be there and deceptively be producing the normal pregnancy hormones. So you might still be there thinking you're pregnant without knowing the pregnancy is already gone. So that's one thing you have to be mindful and careful. And that's why it's very important to make sure you go to a professional, an experienced professional. Once you're pregnant, I will advise you, don't spare any of your money. Make sure you go to the best provider in your city. The reason is very simple. Pregnancy is very complex. From the very point you're pregnant to the day you deliver, anything can happen. Anything can go wrong. And I tell you this, God is the only person that decides what happens. Some women do everything we tell them not to do. They smoke, they drink, they do stuff. But guess what? They have normal delivery. Normal baby. Nothing happens to the baby. Some other women, they want just to have that experience of becoming pregnant, but it's not even forthcoming. And some other women will do everything right when they're pregnant and they still lose the baby. That's why man is not God. But one thing you have to do is to do your own part. Your own part is to be very attentive to your body, very alert, know the normal, know the abnormal. When something happens, please seek help immediately. And that's why I keep emphasizing, once you're pregnant, you've already entered into a sacred relationship with your baby and God. So you're not supposed to take anything whatsoever. No medication, no concussion, no nothing. You must run everything by your doctor. The most important person in your life when you're pregnant, it's not your husband, it's not your dad, it's not your mom, it's your doctor. Because you're on a mission. And that mission is what? To deliver your baby hale and hearty. So you are not supposed to take any medication whatsoever. The only medications you're supposed to take are the ones given to you by your doctor. None. No painkillers. The only painkillers allowed are the ones your doctor gives you, especially the painkillers we call NSAIDs, non-steroidal anti-inflammatory medications. You don't want to take them. Ibuprofen, Aleve, and all those in that family, you do not want to take them when you're pregnant. It can cause a lot of troubles. Anything whatsoever, report to your doctor. Let it be that you're disturbing your doctor, but for the right reasons. Don't listen to your friends. Don't listen to your mom and your husband's mom. They will come with their own doctrine, do this. Don't do that to yourself. You're not going to forgive yourself if you contributed to the demise of your baby, because time is of essence in pregnancy. But in this particular topic we are discussing tonight, you don't have any contribution to whether you're going to have blighted ovum or not. It's something that is going to happen. It's going to happen. Okay, so we're going to talk about how to diagnose this condition. How do you diagnose blighted ovum? So how do you know you have it? Like I mentioned, you have to present to your doctor. Your doctor will ask a couple of questions, your last menstrual period, take the history, take care of the symptoms, try and tie a couple of things together. But the only diagnostic criteria for blighted ovum is to do an abdominal ultrasound to demonstrate that that womb is empty. That's the only way to diagnose blighted ovum. And the only person that can diagnose blighted ovum is an experienced doctor, an experienced OBGYN, an experienced obstetrician. We need to see that sac. We need to make sure that nothing is in there. That's the only time you can say categorically that you have blighted ovum. That's the only way. There is no other way. So it's not a diagnosis you go to anybody to give you. It's a diagnosis you must go to the right channel to get. Very important. And the reason why I'm emphasizing on this, it's also in line with the point I mentioned previously. So if you stay back and you want to use the blood level of the beta HCG to confirm you're still pregnant, when you check the beta HCG, it will still be going up, deceptively telling you that you're pregnant when you're not pregnant. Why? Because the sac can be there and still be producing the beta HCG. But when you take a look at the womb, we'll discover there is no baby there. Very hurtful experience. But guess what? Joy cometh in the morning, no matter what. What you need to do is to follow the next line of discussion I'm going to have with you. So now you've had blighted ovum, one of the worst experiences that can happen to anybody. So what's next? So there are two different management protocols actually three. So some women can opt to just sit it out. They won't take any medical approach to it. They would just want to allow their body to expel the whole contents on their own. That's not the best option. It's always good to expel anything external in the body. Once your baby is no longer viable, the remnants of your baby inside your body can mess your life up. It can actually lead to a lot of complications, including death. So the first management for blighted ovum can be what we call dilatation and curettage. The DNC, you guys normally call it DNC. It's dilatation and curettage. So we want to look inside our womb. We want to remove everything inside, everything. For some women, this is the best option because some women are built in such a way that, oh, it didn't happen. Let's go to the next level. So some women might want to have a complete closure of that ugly event and move to the next level. And this is actually the best approach to blighted ovum because you want to remove everything that will be detrimental to the lady from the womb. When you do this, you give yourself time to recover. One thing we don't do well in Nigeria, which is very bad, everything is spiritualized. Someone wants to blame you, either your husband is blaming you or your husband's mom, or, a lot of blame and shame. But anybody that is bereaved should give themselves time to mourn, to recover your physical body, your emotional part, your psychological body, and your spiritual body. You have to recover fully. You have to feel the grief. Don't hide it. Express it. You're going to go through the stages of grief. You're going to be pissed. You're going to be in denial. You're going to look for who to blame. You're going to be depressed. And finally, you contemplate. Then guess what? You accept. And when you accept, you move to the next phase. It mustn't go in this sequence, but I'm advising you. It's not a common practice back home because, we have a different way we see the world, but that's the right thing. Over here, we have people that can actually talk to people that have lost their baby. We call them doulas. So they go to you, they do everything to help you go through that phase. It's very important you follow your doctor's instructions when you have tragedies. You do not want to rush back to become pregnant immediately because guess what? If you don't address that particular thing that led to that condition and you rush back, chances you're going to have that same problem is very high. So you need to go with your doctor's instructions. The other method of taking care of blighted ovum is to go through medication. So there are some medications we can give you that will help expel the contents from your body. This option is not always the best because we can give you the medication, you can stay 1 or few days before the baby will come out from your body. And for some women, they just want to end that nightmare and move on. It's just like some women, they induce and they still carry the baby inside their body, knowing fully well that the baby is gone. It's a very traumatic experience to women especially. But these are the 3 different ways you can approach blighted ovum, and the most important one and the recommended one is to go for D&C. Remove everything in there. Then normally we'll ask you to relax and make sure you have 3 completed different periods before you try again. But I'm going to say this now. Do not rush back into becoming pregnant. Anytime you have miscarriage, without going to investigate. So in some cases where they have the expertise, when we remove the tissues from your body, we will send it to pathology. Pathologists will look at the tissue to actually see what could have caused that. But in some places, they don't have those facilities. But if you are in a place where they have the facilities, please go ahead and use it. But by and by, blighted ovum, it's not what you should go overboard and be so worked up about it. You're still going to be a mother. You're still going to be a father. What you need to do is to go easy. Okay? So that's the topic we have tonight. Right now, I'm going to open the floor to take a few questions from members, and we'll retire for tonight. I don't know if you had discussed this earlier, but it's abdominal cramp normal for 2 weeks pregnancy. I haven't seen a doctor yet. Well, abdominal cramp, it's not normal in pregnancy. What's normal in pregnancy is feeling of pressure, little discomfort here and there. But anytime you have cramps in pregnancy, like cramps, if what you're describing is actually cramps, you need to go to your doctor. Cramps 2 weeks in pregnancy might be a sign that something is going wrong. So please go see your doctor as soon as possible. Okay? Will blighted ovum or chemical pregnancy cause elevated prolactin? There is absolutely no connection between blighted ovum, chemical pregnancy, and prolactin. Prolactin is an entirely different ball game. There are a couple of things that can lead to prolactin, one of which is prolactin hormone in your brain. Okay? So I've already answered that. Can you please throw more light on chemical pregnancy? Like I mentioned, the only criteria to confirm clinical pregnancy is to see that the baby is in the sac, right? So chemical pregnancy happens in a situation where you have a positive urine test, you've got a positive blood test, but lo and behold, you go to the womb and there is no baby there. That's chemical pregnancy then. But in this situation, in blighted ovum, everything happened normally. Implantation, everything. Then we go in there, we also see no embryo. The sac can be there, but there is no embryo in the sac. So both of them kind of have a gray line where they connect, but that's exactly what happens in chemical pregnancy. So it's always important to go to your doctor as soon as you confirm you're pregnant, so the doctor can make sure he does the right thing. How long do you have to wait? Like I mentioned, some doctors will recommend having 3 periods 3 regular periods before you go back. But everything is dependent on your condition. So your doctor is going to give you a clean bill of health. But let me tell you this. If you ask me, I will advise you to take at least 1 month. It's always good to recover in your mind, in your spirit, in your emotions. Most women will want to rush back to prove that they can become pregnant. And in doing that, they can actually have problems. So take some time, go away, just give yourself time to recover. Okay? Is waist pain harmful to pregnancy? Let me say this. When you're pregnant, your womb expands, right? So there are things we call ligaments. We have a couple of them at the back, at your waist. So if these ligaments are stretching and the weight of the pregnant womb, it can cause pressure on the waist. So waist discomfort and pain is actually one of the things you have to endure in pregnancy. But there's a limit. You have to know your pain threshold. There's a limit that once that limit goes, you have to start going to see your doctor because it might be a sign that you might be losing that baby. Okay? But it's very common to have waist discomfort in women. I have similar issues 3 times now. Within 3 to 4 months, it will start with drop of blood when sent to scan. And so, like I mentioned, please stop rushing to become pregnant. You need to go and see a high-risk fertility specialist, please. Don't rush back to become pregnant. You say 3, 4 months. Take some time out. Go see your doctor. Let's investigate and know why it's happening. So what you're having is recurrent pregnancy loss, recurrent miscarriage. So please stop. Go to your doctor. If your doctor is not well versed to handle your case, request a referral. This is actually what we'll be providing to our members. So most of our members that signed up for pregnancy services, when we analyze your case and it's something the normal gynecologist will take care of, we'll refer you to someone that can do it better. In medical practice, no one knows it all. We have to know our boundaries. So when something is beyond you, you refer. And that's the problem we have back home. And I'm going to say this the way it is. I'm not here to be politically correct. When you're back home, and if any of my colleagues are listening, if you have a case you can handle, don't do magic. Don't try to please the world. Refer the case to who can do it better. The same thing is applicable in women, in infertility. If you see a woman that is having problems with having babies, don't do the Superman. Don't try to impress them. Refer that person to fertility specialist. Very important. If you're listening to me and you're the couple that had that issue with infertility, and you know you're 35 years and above, and you've been trying for 6 months, and you're going to that same doctor, and nothing is happening, move yourself. Don't wait to be moved. Look around, ask around. If you're a member of our services, we can refer you. Seek help. Don't stay back and lay the whole blames on people. Take responsibility, be proactive, okay? Hi, Doc. If you had an induced labor at almost 7 months and you think everything has been expelled, but 2 years after you feel a bulge and the doctor said it might be remnants of expelled. Let me just say this. We're talking about 2 years here now, right? 2 years. 2 years, not 2 months. There is no connection between the labor you had 2 years previously and whatever you have in your belly. And it's not possible that it's still the remnants of the fetus. That's not possible. You cannot have remnants of the fetus in your body for 2 years and you still be normal. That's not possible. You would have had overwhelming infections that can kill you. Always have some logic sequence of events. So I'm challenging you right away. It's not just enough to go to the hospital and you gulp down everything everybody tells you, including me. Challenge me, but challenge me with facts. Ask questions. Look for second opinion. In your city, find out who is the best provider in the city. If there's anything you want to spend your money on, spend your money on your health. I'll give you guys an example. We're just going to do the seminar tomorrow. We have about 728,000 members, and not up to 20 people signed up for that seminar. Put your money into something that can save you if you have the money. So if you're pregnant, make sure you're seeing the best provider in your city. Go for all your antenatal care appointments. Ask around. And the problem is most people that go through all these problems are actually people that are learned. So this is actually where you have to activate your knowledge. I'm not telling you to go there and be challenging your doctor and be very irrational and be very rude. Politely make your case. Ask questions. Discuss your case with the doctor. If you go to your appointments, ask your doctor questions. Doctor, what do you think is the problem? Please, can you explain it to me? What do you think we can do? What's your plan? No doctor will deny you very good discussion of what you're having. And I'm saying this, I know a lot of people will say, oh, you don't know Nigerian doctors and all this stuff. But I'm telling you this, I've practiced in Nigeria before. Most times, the reason why some doctors feel like they don't want to open up is the way they are treated. But when you go there with, even in our group, when you go there with good attitude, believe me, good attitude melts the hardest heart out there. Your first impression matters. How you present your case matters. People pick and select what they can read, but everything you need is out there. So I'm just saying this to encourage you to invest in your health, especially if you're pregnant. What can someone do to increase the growth of a slow? There's absolutely nothing you can do to influence how your baby is growing or not growing. Baby's development are genetically determined. So if your body is good, you don't have infections, you don't have disease, the body is growing properly, you're taking your medications how you should, chances are your baby is going to go okay. But there are also some situations where you do everything right and babies will still have restricted growth. So there is nothing you can do about it right there. Okay? If you're just joining in, what we discussed today is blighted ovum. So blighted ovum is a situation where the eggs will be fertilized and planned properly, but about the 5th to 6th week, when you're supposed to have the embryo, you go to the womb and you won't see no embryo. You just see an empty sac. That's what blighted ovum is. Please find time to read our guidelines. The only way to communicate with us is openly here for now, but previously we have premium services. So if you're a member of premium services, you have an access to all the doctors for a period of 1 year. All those stuff they tell you guys that boost the eggs and all those stuff, it's not functional. They're fooling you. Stop taking it. I don't believe in all those stuff. Okay? If you have problems, let's identify what the problems are and we'll give you solutions. All those fertility days, fertility that, it's just a hyped product. Don't put your mind there, because what happens is there are some people that actually use the fact you're having difficulties and having babies to exploit your mind. So anything they tell you, you quickly go and do it. But please seek help in the right direction. All right. So God bless you and do enjoy the rest of your night.